Hi, are you Rachel?
Yes, I
Hi, Rachel. I'm one of the student nurses here. They said I could follow you around a little bit today. Is that okay?
am. Sure. Yeah.
Can you give me some information about the patient you're about to see?
Sure. I am about to take care of Marta Yarn. She is an 80-year-old female. She's full code. She doesn't have any allergies. She was admitted earlier today with a non-healing ulcer on her sacral area. That ulcer has been present for about 3 months, and she has been being treated for that in an outpatient setting. It's been unsuccessful, so that's why she's here today. Her last assessment revealed vitals. Her blood pressure was 144/90, pulse was 88, respirations were 24 breaths per minute, O2 sats 92%, so we want to keep our eye on that. Her temperature was 99.1, and we want to continue to monitor her pain because it was a 6 out of 10, but she's received medication, so again, we'll ask her about that. Integumentary-wise, like I said, she does have the ulcer on her sacral area. It's 4x4 by 1 centimeter. It's a stage 3 ulcer. There is serous exudate, no undermining or tunneling. She's scheduled for surgical debridement for that tomorrow, but until then we will clean it with saline and cover with a hydrochloride dressing. Otherwise, her skin, she does have poor skin turgor. She's been admitted to the hospital several times for dehydration, so skin is dry. We'll continue to monitor that. Eyes, ears, nose, throat, head. She is slightly hard of hearing and has limited visual acuity, but other than that, denies any problems. Cardiovascular-wise, she has normal sinus rhythm, occasional premature beats. Respirations, lungs are clear, but she does have diminished lung sounds in the bases. We'll monitor that for her. She has been admitted to the hospital several times with community-acquired pneumonia. And her last bout with that was about 6 months ago, so something to keep in mind. GI and GU, soft, non-tender, bowel sounds are present. She denies any problems urinating or changes in bowel habits. She does have a decreased appetite, occasional stress incontinence, and nocturia. So we'll just make sure, that she's eating, drinking, ask her if she has develops any issues there. Neuro, she's alert and oriented. She does report generalized weakness. Musculoskeletal, her gait is coordinated, but she is slow. She uses a walker. She's stand-by assist. She's able to take care of herself. She does report lower back pain. It's been present for about 3 months, usually just alleviated with Tylenol. So we can give her some of her PRNs, like I said, if she is in pain. Recommendations here, we're going to take her vitals every 4 hours. Like I said before, we're going to clean the dressing with saline, cover with hydrochloride until she gets that taken care of by the wound team. She does also have a consult with the dietitian, so they'll take care of that. She'll be NPO after midnight tonight for her surgery, the debridement tomorrow. So those are recommendations. Do you have any questions?
Yeah, a couple questions. Why specifically is this client receiving this medication?
This client is receiving this medication because her culture came back gram-negative. So the medication we give her is to help fight that infection.
Okay. What action does the medication have on the body?
The gentamicin is bactericidal.
Okay.
Inhibit bacterial growth.
When should you question administering this medication?
We would question administering this medication if she had a previous sensitivity to aminoglycosides, like an allergy or something.
Does the medication have a therapeutic serum level?
The medication does have a therapeutic serum level. The peak is going to be between 4 to 10, and the trough is going to be 0.5 to 2 micrograms per milliliter.
Okay. Which vital signs must be monitored?
Well, we're going to monitor all vital signs, but it would be important with this particular medicine to monitor anything that would relate to infection, like heart rate or temperature.
Okay. Which physiological parameters should be monitored when the medication is being administered?
While we're administering this medication, we'll monitor her IV site to make sure we don't see any signs of infiltration there. We're also going to monitor for things like diarrhea, increased fever.
What are the side effects and potential adverse reactions?
So some potential adverse reactions of this gentamicin in particular would be hearing loss. so we're going to make sure. And then we also want to monitor her kidney function because it could affect that too.
Okay. How will you know the medication has been effective?
We'll know this medication is effective if we see a decrease in the gram-negative bacteria in her culture and if her white blood cell count returns to normal. We'll know that the infection is going away, and all this will be documented in her health record.
Okay. I think that's all I have for now.
Okay. So we'll go in and get her IV started.
Okay.
Hello, Martha. How are you?
I'm good.
Good. I'm Rachel. I know we talked earlier here, but I have come to give you the antibiotic that doctor ordered to help your wound heal. So we're going to get started with that if that's okay.
Sure.
Very good. Okay, so I'll wash my hands, and I'm just going to ask you to give me your name and age, please.
Marta Yam, 80 years old.
Very good. And do you have any allergies?
No, I don't.
Okay.
At least none that I know of.
So I'll just confirm here in the computer, no allergies, right patient. Okay, so first I will hook up her primary line, and then we'll hook up the antibiotic as her piggyback. After I get a new glove. Okay, Miss Yarn, I know when we were in earlier you were having some pain. Are you in any pain right now?
No.
Good. Okay, to set up her main line here, I'm going to check with the MAR as I get the medicine out. I'll just check that it's the right medication, the right route, the right time, the right patient, and the right dose. I'm also going to check the actual bag here to look for, make sure everything's intact, make sure the liquid is clear. I'm checking the expiration date. And to get my, to get another check here, I want to make sure I get the green light on the MAR, so I'm going to have to enter her information. Okay, I'm just going to have to look at your name band here. Michael, can you see if you can get this to go on to the next thing, please? I can't get it to click off of that and onto here so I can enter the information. Okay, thank you.
You're welcome. Okay, so I have that green light, so that's a check against the MAR, so we're good to hang our primary tubing here.
the tubing out, I'm going to make sure that the line is clamped. When I go to spike the bag, I'm going to make sure that I don't touch the spike or the insertion site of this tube here because this is all sterile. And we're actually going to use the dial-flow, so I am going to hook that up before I prime so I can make sure everything's primed here. And this is new tubing, so I don't need to clean anything. If it weren't new tubing, I would make sure I use alcohol swabs for 15 seconds on each port before I put them together. Okay, so my third check before I hook her up, I do want to ask one more time. Miss Yard, can you give me your name and age?
Yes, it's Marta E.M. and I'm 80 years old.
And are you allergic to anything?
No, I'm not.
Okay, very good. And I'm just going to confirm here we're giving the sodium chloride with potassium and everything's right here. Very good. Before I hook the IV up to the site, I'm going to ask, do you have any tenderness here associated with this IV site? Do you have any tenderness here?
No, I don't.
Okay, very good. And there isn't any areas of redness or doesn't seem to be any problem. So if that does become sensitive or if you feel like it's hot temperature or something like that, you can let us know.
Okay, sure will.
We'll clean the IV, or we'll clean her port here. We will make sure that our tubing is primed. Okay, very good. And I'll take that back. And this is clean. So I'll hook this up and then I'll set the flow. The primary rate is going to be at 125 mils per hour. So I'll set that and let that run while I get my secondary tubing. Okay, so I'm just trying to save my signature here so that I can get to the next medication and be able to get the green light before I hang my piggyback. Okay, so especially since we're using the dial flow, whatever bag is higher is going to run first just by gravity, so I'm going to lower this primary bag. going to be the same thing as I did with the primary. I'll do with the secondary. I'll just check against the MAR that it's the right patient, the right medication, the right time, the right route, the right amount. And it'll also be the same process when I spike the bag. I don't want to touch the spike or the tube here. Okay, very good. So you want to be really careful when you prime this line to make sure that you don't lose a lot of the antibiotic here. So I have that hanging, and before I hook it up, I want to make sure I can get a check against the MAR again with this green light. So I have to enter the patient ID. So I'm just going to clamp my primary line, clean the port here. Set my dial flow. This medicine is going to be delivered at 100 mLs per hour for the doctor's orders. Reset that there. I'll open both tubes. And then I'll just make sure, I watch for 5 drops to make sure that's running. I'll set a timer. Since this is going to run for about an hour, I'll set a timer for 55 minutes or so to come back in and start the primary. Make sure everything's running fine. I'll be in periodically to make sure that the tube isn't kinked or we don't see any problems there. Okay, so I took my gloves off. I'm going to wash my hands again, and then I just want to talk to you a little bit about some of the side effects of this antibiotic that I told you about earlier today. Do you remember anything that I said you should let us know if you start to experience?
You said if I have hearing loss and if I start to not be able to urinate.
Okay, very good. So definitely keep that in mind, and it may not be just hearing loss. You might start to experience some ringing in your ears or something like that. So any change with your hearing, and definitely if you notice a decrease in the amount of urine, we would want to know that too, okay? You have your call light available, so definitely if you need anything, you can just press that and we'll be in to help you. I did print some more information about the antibiotic. You can look at that. I'll leave that with you. Before I leave, I'll make sure that these lines are labeled. We have the date, the time, and the initial. They probably won't be here in 3 days. It'll probably be changed out, but we'll change it and if needed. Do you have any questions for me before I go?
No, I don't think so.
Okay, very good. We'll be back in whenever you need us, periodically to check the IV. And then, like I said, if you need us before then, just push your call light.
All right, thank you.
Thank you.
Just a couple more. Were there any pertinent pieces of information you reviewed before administering a client this medication?
So before administering any medication, you're going to do, several checks against the monitor, make sure everything I said. You don't want the medication to be expired, so you're looking at that. With this medicine in particular, we're looking again at the levels, the therapeutic serum level. If the trough was too high, we wouldn't administer that. So, and allergies, you're always checking allergies before you administer a medication.
Very good. Did this information affect your decision to administer the medication?
Since we didn't see any problems with anything I just listed, her IV site seemed to be good, we went ahead and administered the medication as ordered.
Okay. And did this information affect how you administered it again?
No, like I said, everything was normal, so we administered as ordered.
Thank you.